Beth Da'Mico. I'm the Executive Director of Nursing at Peninsula Regional Medical Center. Patients are receptive to the process of using SatNav. We explain the process to them and how we're going to be using the information and the device on admission. So when we start using the process, they're comfortable with it. It's in the workflow that the manager currently uses when she's rounding in the patient rooms. And what we notice is that it gives us the opportunity to intervene early into the patient experience. And they see that because when they give us feedback, we're able to correct that experience before discharge and actually improve their stay. Initially, it is something that's important to do is have managers understand the value stream and what this is going to improve. One of the things that we noticed early on by allowing them to be part of the process in question development and in implementation was important. That actually was made that something that they could receive and they could be part of and participate in. In addition to that, what we also were able to prove, but it took starting the process to actually demonstrate this, was that the time that they were going to spend dealing with patient concerns, concerns that had escalated, was actually going to be decreased. Because by being proactive in the assessment of the patient experience, what they could come to expect is that they would be able to intervene early on so that we wouldn't have those multiple hour conversations with one family, and that the time that we devote to SatNav and the patient experience rounding was actually going to improve that ability and actually improve their time and actually be time savings and time management for them in the long run. And it did take us having to implement the process to be able to demonstrate that. But after managers are able to see that their time is going to be better spent being proactive and not being reactive to the patient concerns, it definitely is a benefit to them.
Yeah, it's kind of like putting out the fire before the fire even begins, right?
Yes, it definitely is. And we notice that patients, when they feel their needs are being met and they come to expect a consistent process, they tend to become less reactive because they know someone's going to round, they know someone's going to ask them their feelings, and they know someone's going to respond. So it gives them a safety net that the hospital is actually going to take care of them and meet their needs while they're needed. We know that by using SatNav that we have a predictability to understanding the patient experience. And it's improved our business because what it's allowed us to do is to impact our patient satisfaction scores positively. We know that our patients real time what satisfaction looks like in our organization, and that's been very helpful. In the past, what we really had to depend on were concerns being escalated or there being a written complaint or feedback on our survey scores that there were concerns. Now we actually know real time, and that definitely has made a business case for SatNav because what we realize is it's much better for us as an organization, as frontline care providers, to come in early to the patient's concerns and handle them and address them while they're there. They're the most important resource for us, and we want to make sure we take care of them. I think what we know about SatNav is that it allows us visibility that we didn't have in the past. So when we look at the things that we've done in the medical center to improve the patient experience, this has been the most consistent. It's been the least variable. We designed a process for our clinical leaders to be able to use this process and this platform for the patient experience. And we know that they've been able to achieve higher satisfaction scores on the unit level. This has engaged them differently as leaders because they know it's a working product and they know it's something that's adding value to their time. And as an organization, we know that we've seen the results with our HCAP survey results, and we've seen really the feedback in the community change. We know that when our community talks about Peninsula, they know that we're meeting every need, no matter how large or how small.